Have you ever seen a 70-year-old man walk faster than his 50-year-old grandson? That might sound impossible, but science says it's actually achievable with the right nutrition and supplements. Today, I'm going to tell you about 4 powerful vitamins that can not only stop age-related muscle loss, but even reverse it. It's not just about medicine. Correct knowledge can save lives. Please watch this video until the end, because by the time we finish, you'll have learned the scientifically proven ways to protect your muscle health. Let's begin. 1. Vitamin D. Not just for bones, but for muscles too. Vitamin D is often associated solely with bone health, as it helps the body absorb calcium and prevents conditions like osteoporosis. However, recent scientific research has revealed that this vitamin also plays a vital role in muscle tissue. Having adequate vitamin D levels is especially important in older adults to reduce the risk of falls, preserve muscle strength, and maintain mobility. For example, a large-scale 2021 study conducted by Harvard Medical School found that individuals who took a daily dose of 800 IU international units of vitamin D experienced 25% less muscle loss compared to those who didn't. This demonstrates vitamin D's critical role in combating age-related muscle loss, also known as sarcopenia. A woman named Susan Miller, age 68, is a living example. She had long struggled with climbing stairs and became easily fatigued even after walking short distances. Blood tests revealed low vitamin D levels. Upon her doctor's recommendation, she began taking regular vitamin D supplements. Within a few months, her walking distance improved, climbing stairs became easier, and her overall muscle strength noticeably increased. Susan's improvement clearly shows that vitamin D supports not just bones, but muscles too. The most natural and effective source of vitamin D is sunlight. Our skin can synthesize vitamin D when exposed to the sun. However, as we age, the skin's ability to produce vitamin D significantly decreases. This deficiency is even more pronounced in those who spend little time outdoors or have darker skin tones. Therefore, it's crucial to obtain enough vitamin D through food sources such as fatty fish, egg yolks, and fortified dairy products and supplements if needed. Experts usually recommend 600 to 800 IU of vitamin D daily for older adults, but since each person's needs can vary, it's best to consult a healthcare provider. A simple blood test can measure vitamin D levels, allowing a professional to determine the appropriate dosage. 2. Vitamin B12, nervous system guardian, muscle control ally. Vitamin B12 cobalamin is essential for many vital bodily functions, particularly the nervous system and muscle coordination. While it's commonly associated with memory, concentration, and mental clarity, a deficiency can also severely affect muscle strength, balance, and coordination. It helps form the myelin sheath that protects nerve cells and ensures proper nerve signals to muscles. In individuals over 60, stomach acid production tends to decline, which hinders B12 absorption from the intestines. Gastrointestinal conditions like gastritis, atrophic stomach lining, or Crohn's disease, as well as long-term use of medications like metformin or proton pump inhibitors, can further reduce absorption. Hence, older adults are at a greater risk of B12 deficiency. Recent research shows that B12 deficiency isn't limited to fatigue or forgetfulness. It can also weaken muscles and impair daily movement. A 2020 clinical study in Germany involving 150 participants reported that those who took daily B12 supplements for 3 months improved their balance test results by 30%. This highlights B12's crucial role in both cognitive and motor functions. Take Paul Anderson, a 78-year-old man. He experienced frequent tremors and instability in his legs, relying on a cane to walk. Everyday tasks became challenging, and he constantly feared falling. Blood tests revealed significantly low B12 levels. After beginning B12 supplements as advised by his doctor, his muscle tremors reduced noticeably in just 6 weeks. He could even walk without his cane. Paul's story shows how unnoticed B12 deficiency can progress and how quickly it can be reversed with proper treatment. Vitamin B12 is mainly found in animal-based foods like red meat, eggs, dairy products, and especially liver. However, age-related dietary changes, digestive issues, or long-term medication use can impair absorption. In such cases, B12 may need to be supplemented through tablets, sublingual drops, or injections. B12 levels can be easily measured with a blood test. Symptoms like fatigue, muscle weakness, balance issues, or tingling sensations should prompt a visit to the doctor. With early diagnosis and the right supplements, B12-related motor and balance problems can be prevented. 3. Omega-3 fatty acids. Not just for the heart, but for muscles too. Omega-3 fatty acids, particularly EPA-eicosapentaenic acid and DHA-docosahexaenic acid, are well known for their heart protective benefits. They help reduce blood pressure, lower inflammation, manage triglyceride levels, and improve vascular flexibility. But recent research has added another dimension to omega-3s, muscle health. Omega-3s have been shown to support the fight against age-related muscle loss sarcopenia. A 2022 study published in the British Journal of Clinical Nutrition reported that older adults who took 3 grams of omega-3 supplements daily for 6 months experienced up to a 20% increase in muscle mass. This is due to omega-3's role in promoting muscle protein synthesis, reducing inflammation, and improving blood flow to muscle tissue. Take 72-year-old Emily Johnson. After knee replacement surgery, she faced serious muscle loss due to prolonged bed rest and inactivity. Her physical therapy progressed slowly, and regaining strength was difficult. A nutritionist added omega-3 specifically fish oil capsules to her diet. Within weeks, her muscle endurance improved, and she could exercise longer during therapy sessions. Her recovery sped up significantly. Emily's experience shows that omega-3s don't just protect muscles, they help rebuild them. Natural sources of omega-3 include cold water fish like salmon, sardines, and mackerel, as well as walnuts, flax seeds, and chia seeds. However, many people, especially older adults, don't consume enough of these foods. In such cases, fish oil or algae-based supplements can be beneficial. While plant-based sources in the form of ALA are helpful, their conversion to EPA and DHA in the body is limited, making marine sources more effective for older individuals. Recommended daily intake varies, but generally ranges from 1 to 3 grams. However, if you have heart conditions, take blood thinners, or are recovering from surgery, always consult a doctor before starting omega-3 supplements. Omega-3s are loyal allies not only for the heart, but also for muscles, offering both protective and restorative effects that can significantly improve quality of life in older age. 4. Vitamin E. Antioxidant power for muscle repair. Vitamin E is a powerful antioxidant in the body. It neutralizes harmful free radicals, protecting cell membranes and aiding tissue repair. This function is especially vital for muscle tissue, whether from daily activity, exercise, or age-related degeneration. Microscopic muscle damage occurs regularly. Efficient repair of this damage is essential for maintaining muscle endurance and long-term function. Vitamin E deficiency slows the repair of damaged muscle cells. A study by Ohio State University published in the Journal of Physiology found that muscle regeneration in mice lacking vitamin E was 40% slower. Researchers noted that this was linked to impaired repair of muscle cell membranes. Observational studies in humans have reported similar findings. Adequate vitamin E intake positively influences muscle performance and recovery. Take 75-year-old retired pilot Tom Harris. After years of flying, he kept active in retirement by cycling. But recently, he began experiencing intense leg pain and fatigue. Tests showed low vitamin E levels. After starting supplements on his doctor's advice, Tom saw a clear reduction in muscle pain within weeks. He could cycle for longer and regained his previous level of activity. Vitamin E is fat-soluble, meaning it's better absorbed when consumed with healthy fats. Natural sources include almonds, sunflower seeds, hazelnuts, spinach, avocado, and olive oil. Consistently including these in your diet provides muscles with the antioxidant support they need. However, age-related dietary changes or absorption issues may make supplementation necessary. Important note: high doses of vitamin E supplements, especially when taken without medical supervision, can increase bleeding risk, particularly in those taking blood thinners. Always consult your doctor before using vitamin E supplements. In summary, vitamin E isn't just a beauty or immune-boosting nutrient, it's essential for muscle health. It supports muscle repair, enhances recovery after physical activity, and combats age-related muscle fatigue. Today, we explored the impact of 4 essential vitamins in preventing muscle loss as we age: vitamin D, B12, omega-3, and vitamin E. Scientific evidence shows that getting enough of these nutrients doesn't just preserve muscle strength, it greatly improves overall quality of life as we grow older. So, which of these vitamins do you take regularly? Let us know in the comments. If you found this information helpful, don't forget to subscribe, like the video, and share it with your loved ones so more people can benefit from this knowledge. See you in the next video. Stay healthy.